Are we good? Good afternoon. Thank you for joining me. Today, I have the Secretary of Health, Kim Malsom-Risden, with me, and also the Secretary of Labor and Regulation, Marcia Hultman. One thing I wanted to discuss before I turn it over to Kim and Marcia has to do with revenue and federal government dollars that may be coming to the state of South Dakota in the future, and some that already has. I want to talk about the $1.25 billion in particular. It's the allocation that has come as a result of the Coronavirus Relief Fund. You've heard me outline many times before my concerns about revenue loss and about the impact that South Dakota's economy is feeling and what that does to the state budget and our city budgets going forward in being able to maintain services. The federal discussions continue, and I appreciate all those folks that have been working on getting us some flexibility to utilize some of these dollars for revenue loss, but we aren't there yet. I want to reiterate that as we account for filling some budget gaps, that I don't want a situation where the federal government is forcing us to grow government in order to access and utilize the funds that they have given to us. This pandemic cannot be an excuse to grow bureaucracy or the scope of government. The future of South Dakota is going to be in the hands of the people, not the government, and dictating to us what our programs should look like or how many there should be. So we have been analyzing guidance from Treasury as it relates to spending this money, and we will strictly adhere to the guidance and the reporting requirements that are essential to maintain transparency and accountability going forward. Our immediate focus is going to be on identifying actual expenses that we are incurring as it relates to COVID-19 and our response in the state of South Dakota. Under the CARES Act and under the latest Treasury guidance, it's clear that our state government should keep the entire allocation that they have sent to us. However, I think that it's important that some of these funds be dispersed to our cities and to our counties to help meet some of their needs that they have incurred in response to COVID-19. For everybody's benefit, I wanted to lay out a couple of examples of expenses that local governments should be tracking in order to be eligible for reimbursement. Purchases that are directly tied to COVID-19, such as personal protective equipment, cleaning supplies, testing supplies, equipment that might be necessary for the delivery of telemedicine or remote work. Also, costs that they might incur in order to keep individuals in isolation that have tested positive. These local governments and cities should be tracking those costs. Sometimes for some communities, this may be hotel rooms or other isolation costs that they've had incurred upon them. Other costs related to emergency medical response and equipment and costs in preparation for future COVID-19 response. So at the moment, we're balancing two different things, preserving as much of the funds as possible for revenue replacement to avoid making cuts to education, to healthcare, and other basic services, as well as providing revenue opportunities for reimbursement for state and local governments and counties. This is why it's important that we track these costs accurately and that our local governments are doing that as well so that we can take care of that accountability that we need to have with Treasury following their guidance. As we wait for more guidance and regulations coming out of Treasury, I'm asking that local officials and finance officers be diligent about tracking their costs, make wise spending decisions, and make sure that you're communicating with my office and the Bureau of Finance and Management to continue working to make sure that we have clarity in what will be reimbursed in the future and that we have the flexibility to adjust per the federal guidelines that may come in the future. Please know that we are all in this together, and my team is committed to fiscal stability as well as transparency in all of this process. With that, we've got some questions I know as far as testing plans in the state of South Dakota. So I've asked Secretary Malsom-Risden to come forward and to walk everyone through the plan that the Department of Health has put together. So I'll have Kim come forward and do that.
Thank you, Governor. I'm very pleased to share with folks that we will be beginning some mass testing of vulnerable populations starting next week in the state of South Dakota. I want to remind people that mass testing is really point in time specific, but it can be a foundation for understanding where we might be seeing COVID cases, especially among people that aren't showing symptoms. Following mass testing, we will be doing ongoing random testing to ensure that we are staying ahead of COVID, again, focusing on vulnerable populations. The priority populations that we'll be focusing on starting next week include nursing home and assisted living residents and staff. In the next 2 weeks, we will be testing all residents of nursing homes and assisted livings and the staff in those facilities statewide. This is a very tall order, but I'm very pleased by the response of the nursing home and assisted living industry. Folks recognize that this is a big lift. We'll be administering thousands and thousands of tests, but that it's a foundation for us in our response moving forward. We'll also be working to do and partner to do testing in some of our tribal communities. That's another priority population for a number of different reasons. And our first event is slated to be in the Sisseton-Wahpeton area for next week. That'll be a joint effort between South Dakota and North Dakota as that land shares both of our states. And so we're very pleased to be partnering in that way. We'll also be working with certain employers of essential and critical infrastructure. I think we all know how important it is that people are able to work and be safe when they're at work, and so that is another priority group that we will be focusing on. We've done some widespread testing within that community already, and we are currently working with some other employers that are potentially interested in that, so I hope that we'll have more updates with specifics for that starting next week. Now, moving on from nursing homes and assisted living, we will then be working with other congregate living situations. And so we have providers that serve individuals with intellectual disabilities, other places where group homes where we might see a vulnerable population. And so this is really just the start of us doing aggressive testing in the state of South Dakota, focusing on those vulnerable people on a mass testing level so that we can ensure that we don't have COVID in those populations. Where we do, we can isolate that and hopefully not see large outbreaks. Again, just to reiterate, after mass testing happens, then we do random testing. That's considered sentinel testing. We also have provisions for situations where we do see positive cases in those kinds of settings within our priority populations. And so we'll be doing some continued aggressive testing in those cases so that we can, again, stop the spread of COVID. So very much appreciate Governor Noem's support so that we can do the right thing by these people, use those federal funds to help support this kind of testing effort, and again, in partnership with all the providers out there. Really appreciate everybody rolling up their sleeves and getting this done in the next several weeks.
Thank you, Kim. And again, that plan will start next week in some of those communities and then also in our nursing homes. And we appreciate all the partnerships that we have with the leadership in those areas. So thank you. And I also have Secretary Hultman with me today. We've had some ongoing questions about the unemployment process, and I'd like her to speak a little bit about that and how it's going and give you an update.
Thank you, Governor Noem. First, I would like to take this opportunity to thank my team. During a typical recession, there is a slower curve and some predictability, allowing for a degree of planning and deliberate responsiveness to a gradual increase in unemployment insurance claims. But about 8 weeks ago, it was like a light switch was flipped, and claims instantly and to a degree never before seen began to hit our system. These historic numbers are illustrated by the numbers that we share with the press each week. Since that time, DLR staff have been working around the clock, literally, since the second week in March to implement 3 new federal programs and process thousands of new claims, many submitted by first-time users of the system. What started as a team of 11 has grown to a team of about 70. These 70 people have worked hours equal to 95 full-time people in the past few weeks. Staff have been in the office since day one, while dealing with all the same concerns about their own health and their families that each of you may have. DLR staff have truly exemplified what it means to be a public servant, and I personally cannot thank them and be more proud of them. Today, our numbers again showed an increase of 1,202 initial claims for the week ending in May 9th. Our total initial claim numbers was 5,131 for that time period. We did anticipate this increase. It was not unexpected as we begin to offer the availability of PUA for self-employed, independent contractors, et cetera. And we also now have PEUC, which are extended benefits for some individuals that may have exhausted their claims weeks. They are now eligible for another 13 weeks. So we are now adding those claims to the ones that we are able to take as well. Our continued claim numbers for last week were 23,719. This means 23,719 weekly payments were made to those deemed eligible. Those payments were comprised of $5.3 million of state benefits and an additional $13.3 million in federal benefits, for a total of $19 million that was put back in our economy in just 1 week. Our state trust fund balance remains at about $104.3 million on May 10th. Since March 16th, we have paid out $28.1 million in state benefits, $59.3 million in federal benefits, and $400,000 in PUA claims. This is $87.8 million since March 16th. The number of continued claims will fluctuate each week as employers call employees back to work, individual eligibility circumstances may change, or people may be finding a new job. I would like to acknowledge that we still have claims yet to be processed. Though we have paid claims to over 23,000 people last week, that doesn't matter if you're that one person who is waiting for information on your individual circumstances. The reality is we do still have many claims in queue, and our commitment to individuals is we will continue to work diligently around the clock to process each and every one of those claims yet on hold. And although it is a small constellation, we do have the process now in place to request back payments 4 weeks eligibility requirements were met. My ask of claimants at this time is to please read all the information you receive in your packet. Make sure that you're entering your name, birthday, social security number, address, etc. correctly. And remember, you can check the status of your claim online and understand at the end of the day, not everybody that files a claim is eligible for benefits. Additionally, please do not file a second claim. I know if you've been waiting for some amount of time, the inclination might be, I'm going to speed things up or move this to the top. It actually complicates things greatly, so please do not file a second claim if you've already done so once. If there are no issues with your claim, it will take about 14 days to receive your first payment. If there are issues and one of our staff needs to manually touch it, it will take even longer. We will contact you with any additional information that we may need. I suggest if you talk to one of our staff members, please ask her his or her first name. That will help us to match you with the right person in the future if you have additional questions. Please keep track of your username and password. And every chance I get, I say this, but please do your weekly requests for payments. We're finding out right now today that a lot of individuals have not been doing that, and your claim cannot move forward if you're not going in once a week and doing that request. However, if you've not been doing it, you can do that request for back payments. So nothing is lost. It's just going to slow things down a little bit. And again, please try to be accurate, and please be considerate of the staff that you're talking to on the phone, and we will continue to work diligently with you to make sure that we get your claim processed. Thank you.
Thank you, Marcia. I appreciate that. I did visit with the U.S. Labor Secretary Scalia this morning and talked a little bit about our programs, how they're implementing. He complimented South Dakota on their efforts and your team, Marcia, as well. So it was a great conversation, and he did reiterate the fact that the guidelines that were following in South Dakota will be required by the federal government, and that is why we have the process in place that we have today. So lastly, I wanted to close on just a positive note. This week is Skilled Nursing Home Week. I think we all know we've got a vulnerable population in our nursing homes, and we're so grateful for those folks that show up every day to take care of them and have put in place extra steps to make sure that they're protected from the virus and healthy every day. So join me in celebrating skilled nursing facilities and recognizing the staff there that are fighting to keep our loved ones safe. All of the nurses, the nursing assistants, the staff, the volunteers, the families, they all make a big difference. So thank you. And to the residents in these nursing homes, stay safe, hang in there. We love you. And I encourage all South Dakotans to continue to reach out in creative ways to let them know that we're thinking of them, we love and support them, and we're all anxious to get back to normal. With that, we'll open it up to any questions that you may have.
JP from KORN News Radio.
Sure, go ahead.
This is for Secretary Malsom Reisden. Do you have any rough estimates on how many tests you're going to perform with the nursing homes, assisted living, the community living as such over the next several weeks?
Sure. So in our first week, we will be focusing on nursing homes and attached assisted livings in those counties where there is substantial community spread. We estimate that to be approximately 7,400 people. In the second week, we would target the other nursing homes in the state, in the other geographic areas of the state, and that's about 10,200 people. Again, remember, that's both residents and staff for each of those numbers. In weeks 3 and 4, we would be looking at testing the remaining assisted living centers in the state, and for each of those weeks, that's another 4,300 tests. Again, those are just for the nursing homes and assisted livings. After we get through the assisted livings, we'll move on to other congregate care settings, and so we're still working on the numbers and the planning for that. That's also not counting the work that we will be doing with tribal communities and specific employer outreach.
Thank you.
This is Morgan from Rapid City Journal.
Sure, go ahead, Morgan.
Kim, you mentioned earlier the tribal communities, starting with Sisseton and Wahpeton. Can you talk through the plan for reaching all the tribes in the state in the next few weeks with that mass testing?
So we are still working through some of that communication process, and so we have been in contact with other tribes who have requested some additional testing in their communities. I expect that we should have more details on where we will be going next week.
And for all this mass testing, it's all up to each of the individual, assisted living, nursing homes, all of the little hospitals and clinics. It's all on them just to kind of keep going with the Abbott ID Now testing that they have. It's not like something the state would roll out to each and every place with their mobile lab to do a lot of this.
Sure. So the way mass testing will work in nursing home and assisted living and other healthcare types of settings is the staff at those facilities will do the collection of the specimen itself, and then we are helping those facilities that don't already have a laboratory that they work with to have a commercial laboratory available to process those specimens. The cost of processing all of those specimens, no matter where they're processed, will be covered by the state of South Dakota.
And then the mass
South Dakota
testing,
News Bell.
it'll take that 4 weeks, not a 2-week process for the mass testing.
Sure. So we will be testing new groups every single week, and so for the first groups of nursing homes and assisted livings, we have that scheduled over a 4-week period.
Okay, thank you.
Josh, Dakota News Now.
Yes, go ahead, Josh.
How will these mass testing events for nursing homes affect the state's testing supplies? Specifically, how it will impact the goal of making tests immediately available for anyone showing COVID symptoms?
So the reason we're able to move forward with mass testing at this time is because the supply chain has gotten better on testing supplies, as well as the PPE that we need for testing to be done safely. So we're seeing good signs in that regard. We do not anticipate that the mass testing that we're looking to do will impact our regular testing that needs to happen for people that have symptoms. So when we go in and do the mass testing like we're proposing, we will still make sure that we have the state supplies needed to continue to test other people that wouldn't be part of these mass testing events.
Thank you.
Governor,
This is Ariel with the Journal.
Let's go to Patrick in the room, and then we will go to the Rapid City Journal.
Thank you. Patrick Callahan, South Dakota Broadcasters. We spoke on Wednesday about communications with the tribe. Could you give me a sense of events since then, and then a follow-up to that, if I could?
Sure. The two tribes in particular that we're visiting with about the checkpoints in question would be Cheyenne River and the Oglala Sioux tribe. And we have sent them a plan for how we think the checkpoints could be facilitated in different locations. And both the chairman and the president of Oglala has said that they're taking a look at those. So we're anxiously awaiting their response and their evaluation of those plans. Which I think is encouraging that they didn't reject them outright and are considering the proposal. And then we also have had several other conversations with other tribes about ideas that they have in place for checkpoints, and we're having conversations with them as well.
And if I could follow up, since that time, we've heard about a letter from 17 state lawmakers, and since that time, another state lawmaker has weighed in, called it a 180. Various different reports.
I think you're referencing Ryan Maher, and that was just a specific political attack. I think we all know that Ryan used to be a Democrat, and that he actually encouraged us and that we did a good job days earlier on communications with the tribe, and that it was discouraging to see that in the newspaper. So, the fact is we're communicating, we're talking with our tribes, we're working out a plan. And Ryan has supported all my political opponents against me in the past, and that's what's so disappointing about this, is that we're in the middle of a pandemic and we continue to see articles and situations like that. So my hope is we can stay united, continue the conversations, and come up with a resolution that will protect the people of South Dakota and make sure that we're making the best decisions going forward. Was there a question on the phone from the Rapid City Journal?
Yes, this is Ariel. This is kind of a technical question. So just again with the checkpoints. So the BIA memo says that tribes can only do checkpoints on state and federal highways if the owner agrees. So my question is, who does own state and federal? I mean, it may be obvious. I mean, does the state own state roads? Does the federal government own federal roads?
Well, the indications is that, and this is one of the reasons we're asking for clarity from the federal government, is that it is federal jurisdiction on state and federal highways and tribal jurisdiction on BIA roads. So that's why we communicated with the tribes that if they wanted to facilitate checkpoints on BIA roads, that would be more acceptable to the state of South Dakota. And we'll continue having those conversations to see if that is something that's acceptable to them as well.
So I guess my question is if it's, like you just said, it's federal who's in control of both the state and federal highways. So why is the state of South Dakota even involved? Shouldn't the tribes be talking with the federal government about this?
Yes. In several of my interviews and here at these press conferences, I have indicated that I would appreciate the federal government recognizing and upholding their federal laws so that transportation can happen on these highways. That's why we're asking for clarity. That's why we're having this communication. The BIA did tell the tribes to come up with an agreement with the state of South Dakota that would facilitate transportation happening on those roadways. And so that's why we're talking and communicating with tribes, but we are hopeful that the federal government will be the ones that actually take action as it is their jurisdiction.
But why is the federal government even telling the tribes to discuss it with the state if it's a federal issue only?
That's a great question for the federal government. I'd suggest you ask them.
Okay. I will do that.
Good. Next question?
Governor, this is Stephen Groves from the AP.
Yes, go ahead, Stephen.
If the road checkpoints aren't removed from federal or state highways, are you still planning to sue the tribes?
I think that we are working through our process, and we're hopeful that we can come to a resolution. I'm going to stay really optimistic about the situation, and hopeful that we can find a resolution soon.
Governor Noem, Gordon Richard, Alcester Union. Tonight,
Yes, go ahead, Gordon.
yeah, on that $1.25 billion relief fund, the hardest working people in this county, I believe, are the schools. School people providing food. How will schools ultimately maybe track their expenses related to this? Will they get some of the $1.25 billion?
Well, I believe that the schools are already tracking their costs, and there are separate dollars that flow directly for education costs to them that are coming and maybe have already been allocated. So that is something that has been addressed at the federal level, that I believe those school districts will be adequately reimbursed for their costs.
All right. Thank you.
Further questions?
This is Lisa with the Argus Leader.
Sure, go ahead, Lisa.
Yeah, on the mass testing, just wondering if you're expecting the number of positive cases to start going up dramatically once you begin that.
I do expect to see an increase. As we test more, we always see an increase in positive cases, and we're focusing on our vulnerable population in our nursing homes and assisted care centers, and then also looking at those counties where we do have community spread or substantial spread. So looking at the areas where we anticipate that getting folks isolated quickly could make a difference is something that we're using as a priority.
Governor Lee Strubinger, SDPB.
Sure, go ahead, Lee.
Thank you. I was wondering if you could talk a little bit about, I guess, how you see what the feds are telling the state and how they can use the federal money. You know, you had mentioned not wanting to grow government, but what are those programs, or where would that money go that you are seeing from the Fed that you're saying that they're saying is good to spend it on, that you would rather not spend it on?
Well, there are, what I've asked them for is the ability to use it for revenue replacement and hold me accountable to dates that the virus would have impacted the state of South Dakota. They have talked about the fact that they want to maintain integrity in their programs, and I back that up as well. I just don't want to be in a situation where the only way we can access and utilize this money is by putting in place a new program in the state of South Dakota. And that would be the unfortunate event that we would have to grow government in our state in order to utilize those funds. And so those communications are ongoing, and I think some of the guidance that we've gotten from Treasury has been helpful in recognizing the need to have some flexibility in how we pay for certain response and investments related to COVID-19. So that partnership has been helpful so far. We're not quite there yet, but we're hopeful that we can get a resolution soon. Any further questions?
Hi, Governor. This is Stephen Grobstick from
Sure.
Michigan.
Go ahead, Stephen.
I'm wondering if you could explain a little bit the change in your approach from last week, giving a 48-hour ultimatum to tribes with the checkpoints, to this week working to kind of create a dialogue and, as you said, work through the process to create a resolution. What changed with that?
I would say nothing's changed. We've been communicating with our tribes for weeks about these checkpoints. Last week, we sent a letter saying that we needed to have them consider and move those checkpoints. They have rejected that, so I sent them a plan that I'm hoping they will find acceptable.
So with the urgency over the weekend, with the 48 hours, what was some of the reasoning behind the urgency?
I wouldn't say it's urgency. I would say that many phone calls to our offices, phone calls to the federal congressional offices indicate that it is an issue and that there isn't consistency from checkpoint to checkpoint, and that some of the activities that are happening there needed to be clarified. So in response to what we were hearing and seeing, we recognized that we needed to have a resolution and continue the conversation going forward. All right, any further questions? Okay, thanks everybody.